Did you know that something as humble as a small box of baking soda could quietly hold the power to transform your health? Sitting right there in your kitchen cabinet, often forgotten next to spices and old recipe books, is a powder so potent. Some experts call it the most overlooked natural remedy of our time. That's not an exaggeration. According to a report published in the Journal of Clinical Pharmacy and Therapeutics, sodium bicarbonate, known to most of us simply as baking soda, has been extensively studied for its ability to assist in everything from chronic kidney conditions to balancing the body's acid-base levels. And yet, despite this mountain of research, over 80% of people who regularly purchase baking soda use it for nothing more than baking cookies or freshening their refrigerators. But what if I told you this common household item holds secrets that could not only improve your well-being, but actually help prevent or manage over a dozen health issues that seniors face every day? Imagine this for a moment. You're struggling with persistent acid reflux after meals, spending restless nights trying to ease the burning in your chest, or maybe arthritis pain stiffens your joints each morning, making even the simple act of tying your shoes a painful chore. These are discomforts that millions of seniors quietly endure, believing that aging naturally brings this kind of suffering. But what if nature already handed us a simple, science-backed solution, one that's been sitting under our noses all along? Stay with me, because in this video, we're going to pull back the curtain on the incredible hidden health benefits of baking soda. And this isn't based on hearsay or old wives' tales. We're diving into research straight from respected scientific journals like the Journal of the American Society of Nephrology, the Journal of Clinical Dentistry, and the Journal of Immunology. By the end of this video, you'll understand exactly why health enthusiasts and even some forward-thinking doctors are turning to this affordable kitchen staple as part of their wellness routines. I'll also make sure you're fully informed about the risks, because like all powerful remedies, baking soda must be used wisely and safely, especially for those with specific health concerns. Before we dive in, if you're new here, welcome. Our mission is to help you take control of your health, feel empowered, and live vibrantly at any age. So go ahead and tap that subscribe button, and tell us in the comments, where are you watching from today? We love hearing from people all around the world who are committed to living healthier, happier lives. All right, let's not waste a moment more. Grab a pen and paper, because what you're about to learn could make a real difference in your life or in the life of someone you love. Let's unlock the first hidden power of baking soda, its incredible ability to support your body's natural detoxification system. Let's start with one of the most fascinating and misunderstood powers of baking soda, its role in supporting your body's natural detoxification processes. You see, in today's world, our bodies are under constant assault from environmental toxins, whether it's the polluted air we breathe, the processed foods we eat, or the medications we take. Over time, these toxins accumulate, leaving us feeling sluggish, bloated, and just off balance. That's where the alkaline magic of baking soda comes in. At its core, baking soda is sodium bicarbonate, a naturally occurring compound with powerful alkalizing properties. When dissolved in water, it forms a solution that can help neutralize acids both inside and outside the body. But what does this really mean for your health? Well, let's break it down. Your body works hard to maintain a balanced pH, especially in your blood, which stays tightly regulated between 7.35 and 7.45. However, modern diets high in processed foods, sugars, and animal proteins tend to push our systems toward acidity. While your body has built-in mechanisms to manage this, chronic low-level acidosis can contribute to inflammation, weakened immune function, and even accelerate age-related diseases. This is where baking soda steps in as a gentle but effective alkalizing agent. Some health experts recommend using a simple baking soda solution, about half a teaspoon mixed into a glass of water, to help temporarily neutralize excess acids in the body. This practice is believed to create a more balanced internal environment, making it easier for your body's natural detox pathways like the kidneys and liver to function more efficiently. And this isn't just folk wisdom. A landmark study published in the Journal of the American Society of Nephrology found that patients with chronic kidney disease who supplemented with sodium bicarbonate experienced a slower progression of kidney disease. Why? Because reducing acid buildup in the blood relieved the kidneys from working overtime. That's powerful evidence that something as simple as baking soda could help lighten the detoxification load on your organs. But detoxification doesn't just happen internally. Many people swear by baking soda baths to draw out impurities through the skin. This age-old remedy involves adding 1 to 2 cups of baking soda to a warm bath and soaking for 20 minutes. The theory: the alkaline water helps soothe irritated skin, reduce itchiness, and pull toxins out through the skin barrier. While scientific evidence for skin detox is limited, there's no denying that countless people report noticeable improvements in skin comfort after such baths. In fact, a study published in the Journal of Dermatological Treatment highlighted that baking soda baths provided relief for patients suffering from psoriasis and eczema by reducing skin inflammation and improving hydration. Of course, it's important to approach this practice mindfully. Overdoing internal consumption of baking soda can lead to alkalosis, a condition where the body's pH becomes too high, resulting in symptoms like muscle twitching, confusion, and nausea. Moderation is key. Stick to no more than half a teaspoon of baking soda in water once a day. And always consult your healthcare provider if you're managing chronic health conditions. So, should you replace all your detox habits with baking soda? Absolutely not. But used wisely. This humble kitchen ingredient can be an affordable and effective support tool, helping your body stay balanced, refreshed, and resilient against the toxic overload of modern life. Coming up next, we'll explore how baking soda doesn't just help your internal health. It can also transform your smile by improving oral health and naturally whitening your teeth. Let's move from internal wellness to something that lights up every room you walk into. Your smile. Believe it or not, baking soda holds a well-earned reputation in the world of oral health. And it's not just because it's been passed down through generations as a home remedy. Science backs it up, and the results might just surprise you. Have you ever finished brushing your teeth and run your tongue over them, noticing that silky smooth feeling? If you've used baking soda even once, you've likely experienced this firsthand. That's because baking soda acts as a natural, gentle abrasive. Its fine particles scrub away the surface stains caused by daily culprits like coffee, tea, red wine, and even those hidden sugars that lurk in processed foods. But unlike many commercial whitening products that contain harsh chemicals and abrasive agents, baking soda is surprisingly mild on your enamel when used properly. This makes it a safer alternative for seniors who may already have thinning tooth enamel or increased tooth sensitivity. In fact, a clinical study published in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque and whitening teeth than toothpaste without it. The reason baking soda not only physically removes stains, but also chemically neutralizes acids in the mouth that contribute to enamel erosion and discoloration. But the benefits don't stop at aesthetics. Baking soda plays a critical role in maintaining a healthy environment inside your mouth by balancing pH levels. Your mouth is a battleground where harmful bacteria thrive in acidic conditions. Left unchecked, this acidic environment leads to cavities, gum disease, and chronic bad breath. By creating a more alkaline environment, baking soda disrupts the growth of these harmful microbes, making it much harder for them to survive and multiply. In simple terms, it's like turning off the welcome sign for bacteria that cause gum inflammation and decay. Need more proof? Research published in the Journal of the American Dental Association confirmed that regular use of baking soda-based rinses and toothpastes helps reduce harmful bacteria levels, including Streptococcus mutans, the main culprit behind tooth decay. So how should you use baking soda safely for oral health? For daily maintenance, add a small pinch of baking soda directly onto your regular toothpaste once or twice a week. Brush gently in circular motions using a soft bristled toothbrush. For stubborn stains, create a simple whitening paste by mixing half a teaspoon of baking soda with a few drops of water. Apply it to your teeth and gently brush for no more than 2 minutes. Rinse thoroughly afterward. As a mouth rinse, mix half a teaspoon of baking soda in a glass of warm water and swish it around your mouth for 30 seconds. This not only freshens your breath, but also helps neutralize acid buildup after meals. A word of caution: moderation is key. While baking soda is less abrasive than commercial whitening agents, using it too frequently or brushing too hard can still wear down enamel over time. Most dentists recommend limiting its use to 2 or 3 times per week, especially if you have sensitive teeth or receding gums. And if you're wondering whether baking soda can replace your fluoride toothpaste entirely, the answer is no. While it's a powerful supplement to your oral care routine, it doesn't contain fluoride, which plays an essential role in strengthening enamel and preventing cavities. So, think of baking soda as a valuable ally in your dental care toolkit. Used correctly, it's a safe, natural, and cost-effective way to keep your smile bright, your breath fresh, and your gums healthy, all without the expense of whitening treatments or chemical-laden products. Up next, we'll discuss a common discomfort many seniors face: heartburn and acid reflux, and how baking soda offers rapid, natural relief for these painful episodes. When you think of baking soda, you probably imagine its role in baking or maybe freshening up your fridge. But did you know that this simple powder holds remarkable power against fungal infections? Those stubborn, itchy, and often embarrassing skin conditions that many seniors quietly struggle with. Fungal infections are more common than you might think, especially as we age. Reduced immune function, slower circulation, and thinner skin create the perfect storm for these opportunistic microbes to take hold. Conditions like athlete's foot, ringworm, jock, itch, and even fungal nail infections aren't just cosmetic concerns. They can significantly impact your comfort and mobility. So how exactly does baking soda help fight back? At its core, baking soda creates an alkaline environment that fungi find incredibly inhospitable. Fungal organisms, like Candida albicans and Trichophyton rubrum, the main culprit behind athlete's foot, thrive in warm, moist, and acidic conditions. By applying baking soda directly to the skin or using it in foot baths, you're effectively altering the pH of the skin's surface, making it harder for these harmful fungi to survive, spread, and multiply. And the science backs this up. A study published in the journal Mycopathologia found that a 10% solution of baking soda inhibited the growth of over 80% of fungal strains tested, including those responsible for common skin infections. The alkaline environment not only weakens fungal cell walls, but also disrupts their ability to reproduce. This makes baking soda a powerful natural antifungal agent without the side effects of harsh chemical treatments. Let's talk about some practical ways you can use baking soda to combat fungal issues. Baking soda. Foot soak. Add 2 to 3 tablespoons of baking soda to a basin of warm water and soak your feet for 15 to 20 minutes. This method helps reduce moisture, neutralize foot odor, and create a hostile environment for fungi, especially in cases of athlete's foot. You can do this daily until symptoms improve. Topical baking soda paste. Mix 1 tablespoon of baking soda with a few drops of water to create a thick paste. Apply directly to affected areas like between the toes or on flaky patches of skin. Let it sit for 10 to 15 minutes. Then rinse thoroughly and pat dry. Repeat twice daily, until the infection subsides. Baking soda powder for moist areas. After bathing, dust a light layer of dry baking soda onto areas prone to sweating and fungal growth like underarms, under the breasts, or between skin folds. This helps keep these areas dry and prevents fungal spores from taking hold. One added benefit: baking soda also acts as a natural deodorizer, eliminating unpleasant smells often associated with fungal infections, especially in the feet and groin area. But before you rush off to try this, remember, consistency and patience are key. Natural remedies typically take longer to show results compared to prescription antifungal creams, but they're often gentler and free of harsh side effects. However, it's important to recognize when a fungal infection requires medical attention. If symptoms persist after 2 weeks of home treatment, or if you notice increasing redness, swelling, or pain, it's time to consult your healthcare provider. Fungal infections left untreated can sometimes lead to secondary bacterial infections, especially in seniors with diabetes or compromised immune systems. Also, if you have sensitive skin, test a small area before applying baking soda widely. While it's generally gentle, prolonged use on very delicate skin might cause minor irritation in some individuals. So, the next time you feel the familiar itch or spot the telltale red, flaky patches of a fungal infection, remember, relief might just be sitting in your kitchen. Affordable, effective, and backed by science, baking soda remains one of nature's most reliable defenders against these stubborn health nuisances. In the next section, we'll address an even more sensitive topic: urinary tract infections, and explore how baking soda may offer natural relief from this painful and frustrating condition. For anyone who has experienced a urinary tract infection, you know how disruptive and painful it can be. That sharp, burning sensation while urinating, the constant feeling that you need to go even when your bladder is nearly empty, and the discomfort that lingers throughout the day and night. These aren't just minor annoyances. For many seniors, recurring UTIs can severely impact quality of life. While antibiotics remain the primary treatment for bacterial UTIs, there's growing interest in natural remedies that can provide relief and support faster recovery. One such remedy, surprisingly enough, is the humble baking soda. But how can something sitting in your kitchen cabinet possibly help with such a serious health issue? Let's start with the basics. UTIs occur when harmful bacteria, usually Escherichia coli, E. coli, find their way into the urinary tract and multiply. These bacteria thrive in acidic environments, which is why the burning sensation is often worse when urine is highly acidic. Baking soda, or sodium bicarbonate, works as a natural alkalizing agent. When dissolved in water and consumed, it raises the pH of your urine, making it less acidic. This shift not only helps relieve the painful burning sensation, but may also create a less hospitable environment for bacteria to survive and multiply. In fact, a study published in the Japanese Journal of Urology explored this very concept. Researchers administered sodium bicarbonate supplements to a group of women suffering from recurrent UTIs. After 4 weeks, many participants reported a significant reduction in painful urination and overall discomfort. While the researchers cautioned that this approach should not replace antibiotic therapy, they acknowledged baking soda's role as a supportive remedy to ease symptoms. Here's how to use baking soda safely for UTI relief. Alkalizing UTI relief drink. Mix 1-2 teaspoon of baking soda in a full glass of water. Drink it slowly, preferably on an empty stomach. This can be repeated once or twice a day, but always under the supervision of your healthcare provider if symptoms persist. By reducing urine acidity, this simple drink can provide almost immediate comfort. However, it's critical to understand that baking soda doesn't kill the bacteria causing the infection. It simply helps manage the painful symptoms while your body, and potentially antibiotics, work to clear the infection. And while it may feel tempting to rely solely on natural remedies, Untreated or poorly managed UTIs can lead to serious complications, especially for seniors. The infection can spread to the kidneys, leading to a much more severe condition called pyelonephritis, which often requires hospitalization. So when should you try baking soda, and when should you seek immediate medical attention? Try baking soda for mild discomfort or in the early stages of symptoms while monitoring closely. Seek immediate medical care. If you experience fever or chills, lower back pain, a possible sign of kidney infection, blood in your urine, persistent or worsening symptoms after 48 hours. Also, individuals with high blood pressure, heart conditions, or kidney disease should be extremely cautious. Baking soda contains sodium, and consuming too much can lead to fluid retention, increased blood pressure, and even dangerous imbalances in the body's electrolytes. If you're prone to frequent UTIs, it's also worth exploring long-term prevention strategies. Stay well hydrated. Aim for at least 6 to 8 glasses of water daily. Practice good hygiene habits, especially after bathroom use. Include cranberry supplements or unsweetened cranberry juice in your diet. Some studies suggest it helps prevent bacterial adhesion to the bladder walls. And, for some, a daily baking soda drink under medical supervision might help keep the urinary tract environment less inviting to harmful bacteria. In conclusion, while baking soda is no miracle cure, it offers a gentle, affordable, and science-supported way to ease the discomfort of UTIs while you seek appropriate treatment. It's yet another reminder that some of the most powerful healing tools have been with us all along, hidden in plain sight. Next, we'll explore a particularly painful little nuisance, canker sores, and how baking soda can help soothe and heal these stubborn mouth ulcers quickly and naturally. When you think of performance-enhancing substances, your mind probably jumps to expensive supplements or complicated workout regimens. But what if I told you that one of the most effective, science-backed ways to boost endurance and fight muscle fatigue is already sitting in your kitchen cupboard? Yes, we're talking about the humble but powerful baking soda. While it might sound surprising, baking soda or sodium bicarbonate has long been used by elite athletes and fitness enthusiasts as a natural way to improve performance, especially during high-intensity, short-duration activities like sprinting, swimming, and weightlifting. But here's the exciting part: you don't have to be a professional athlete to benefit from it. Seniors looking to maintain muscle health and stay active can also use this simple remedy to fight fatigue and keep their bodies moving longer and stronger. Let's break down how it works. During intense physical activity, your muscles produce lactic acid, a byproduct of energy metabolism. As lactic acid builds up, it lowers the pH inside your muscles, creating an acidic environment. This is what leads to that familiar burning sensation in your muscles and the feeling of fatigue that forces you to slow down or stop altogether. Baking soda acts as a natural buffering agent. When consumed before exercise, it helps neutralize this acid buildup, allowing you to push through those tough workouts with less discomfort and delay the onset of fatigue. This buffering effect can be especially helpful for seniors participating in strength training or endurance exercises designed to preserve muscle mass and prevent age-related decline. And the science behind this is rock solid. A meta-analysis published in the Journal of Strength and Conditioning Research reviewed multiple clinical trials and concluded that sodium bicarbonate supplementation significantly improves performance in high-intensity, short-duration activities. The study found that participants who took baking soda before exercise experienced delayed fatigue, improved endurance, and were able to maintain peak performance for longer periods. So, how can you safely incorporate baking soda into your exercise routine? Pre-workout performance drink. Mix 1/2 to 1 teaspoon of baking soda into a glass of water and drink it about 60 to 90 minutes before your workout. This gives your body enough time to absorb the bicarbonate and begin buffering acids effectively. Important considerations. Start with a smaller dose to see how your body reacts. Some people may experience mild gastrointestinal discomfort, including bloating or nausea, especially if too much is taken at once. To minimize this, split the dose into smaller portions and drink plenty of water. This simple routine can make a noticeable difference in how long you can sustain your activity. Whether it's a brisk walk, a session of strength training, or even an afternoon of gardening. But why is this particularly important for seniors? As we age, maintaining muscle strength becomes a critical factor in preserving independence and reducing the risk of falls and injuries. The condition known as sarcopenia, or age-related muscle loss, affects up to 50% of people over the age of 60. Regular exercise is one of the best ways to combat this. But staying active isn't always easy when muscle fatigue sets in quickly. Baking soda can give you that extra edge, helping you power through those last few reps or finish that extra lap around the park. Of course, this doesn't mean baking soda is a magic bullet. It should always be part of a balanced approach that includes proper hydration, nutrition, and a consistent exercise routine. And as with all supplements, it's important to consult your healthcare provider before adding baking soda to your routine, especially if you have conditions like high blood pressure, kidney disease, or heart problems, since the sodium content could pose risks if not monitored carefully. In summary, baking soda isn't just for the kitchen. It's a powerful, science-backed tool to help you stay active, fight fatigue, and get the most out of every movement. Whether you're walking, lifting, stretching, or simply trying to stay fit and independent as you age. This simple and affordable remedy might be exactly what you need to go further, longer, and stronger. Next, we'll discuss a truly life-changing benefit: how baking soda can help support kidney function and protect against chronic kidney disease progression. Your kidneys are remarkable organs, quietly working 24 hours a day to filter waste, balance fluids, and maintain essential chemical balances in your body. But as we age, these hard-working filters often face increasing challenges. Chronic kidney disease. CKD now affects nearly 1 in 7 adults in the United States alone. And the numbers are even higher among seniors. What if a simple, inexpensive solution like baking soda could play a role in protecting your kidneys and slowing the progression of this debilitating condition? It may sound too good to be true, but compelling scientific research suggests otherwise. In fact, a landmark study published in the Journal of the American Society of Nephrology found that sodium bicarbonate supplementation significantly slowed the decline of kidney function in patients with advanced CKD. The results were so promising that patients taking daily doses of baking soda were far less likely to develop end-stage renal disease or require dialysis compared to those who didn't. So, how does it work? One of the major issues in chronic kidney disease is the body's inability to properly eliminate acids from the bloodstream, leading to a condition known as metabolic acidosis. This acid buildup doesn't just cause discomfort. It actually accelerates kidney damage and contributes to muscle wasting, bone density loss, and systemic inflammation. Baking soda, as a natural alkaline compound, helps neutralize excess acids in the blood, easing the burden on the kidneys. By restoring a healthier acid-base balance, the kidneys aren't forced to work overtime, which can slow the rate of disease progression and improve overall well-being. But this benefit isn't limited to those already diagnosed with CKD. Seniors who are at risk of kidney issues due to high blood pressure, diabetes, or prolonged use of certain medications can also benefit from understanding how managing acid balance supports long-term kidney health. Here's how baking soda is typically used under medical supervision for kidney health. Typical dosage. Patients in clinical studies were given 600 to 1,800 milliliters of sodium bicarbonate per day, usually divided into 2 or 3 doses. This equates to approximately 1/2 to 1 teaspoon per day, dissolved in water, taken after meals. Important caution. Never start a baking soda regimen for kidney support without consulting your healthcare provider. Because baking soda contains sodium. Improper use can lead to fluid retention, increased blood pressure, or dangerous electrolyte imbalances, particularly in those already dealing with heart or kidney conditions. And while baking soda can offer real support, it's not a cure-all. It works best when combined with a kidney-friendly lifestyle, including limiting sodium intake to reduce fluid retention and blood pressure strain, staying well hydrated, but under guidance if fluid intake is restricted by your doctor, adopting a low-protein, plant-rich diet, which reduces acid load on the kidneys, managing blood sugar and blood pressure levels carefully, as these are the two biggest risk factors for kidney decline. Another encouraging discovery. Research shows that patients who took baking soda supplements not only slowed their disease progression, but also experienced improvements in muscle strength and physical function, thanks to reduced acidosis. This is a significant quality of life improvement, especially for seniors hoping to maintain independence and mobility. However, overuse of baking soda can have serious consequences. Taking excessive amounts can lead to a condition called alkalosis, where the blood becomes too alkaline, causing muscle twitching, confusion, nausea, and, in severe cases, even heart arrhythmias. That's why it's so critical to use this remedy responsibly and under professional supervision. In summary, baking soda offers a promising, low-cost way to support kidney health and slow the progression of chronic kidney disease backed by real scientific evidence. When used correctly, it can help ease the body's acid burden, protect precious kidney function, and improve quality of life. Next, we'll explore another chronic issue many seniors face: arthritis pain, and how baking soda may help calm inflammation and provide lasting relief from this painful condition. Arthritis is a condition that affects more than 50 million adults in the United States alone, and it's one of the most common causes of chronic pain and disability among seniors worldwide. Whether it's the deep, dull ache of osteoarthritis or the burning, swelling discomfort of rheumatoid arthritis, the pain can make simple, everyday tasks like opening a jar or going for a walk feel overwhelming. But what if something as simple and affordable as baking soda could offer relief by calming the overactive inflammatory response at the heart of arthritis pain? Recent research suggests this humble kitchen ingredient may have the potential to do just that. You see, chronic inflammation is a key driver of arthritis pain. In conditions like rheumatoid arthritis, RA, the body's immune system goes into overdrive, mistakenly attacking its own tissues, especially the joints. This results in persistent swelling, stiffness, and pain that can make daily life a constant struggle. Here's where baking soda comes in. Studies have shown that baking soda may help retrain the immune system to reduce unnecessary inflammation. A groundbreaking 2018 study published in the Journal of Immunology found that a simple daily solution of baking soda and water could shift the immune response from a pro-inflammatory state to an anti-inflammatory one. In this study, both human participants and animal models experienced significant reductions in inflammatory markers after consuming baking soda regularly. The researchers discovered that baking soda influenced specialized immune cells called macrophages, encouraging them to behave less like attack dogs and more like peacekeepers. This change in immune behavior reduced systemic inflammation and helped soothe the body's overactive immune responses, exactly what's needed to ease arthritis symptoms. So how can you safely incorporate baking soda into your routine to help manage arthritis discomfort? Anti-inflammatory baking soda drink. Dissolve 1 or 2 teaspoons of baking soda in a full glass of water and drink it once daily. It's best consumed on an empty stomach or after a light meal to maximize absorption. Important note: this remedy should not be used long-term without supervision from a healthcare provider, especially if you have high blood pressure or kidney concerns. While baking soda helps neutralize acid and calm inflammation, it does introduce additional sodium into your system, which could pose risks if consumed excessively. Beyond its anti-inflammatory effects, baking soda may also help indirectly by addressing one of arthritis's hidden enemies, low-grade metabolic acidosis. This is a condition where the body's internal pH becomes slightly acidic, a state that's been linked to increased inflammation and bone demineralization. By helping restore a more balanced pH, baking soda could reduce the overall inflammatory load on the body and even support healthier bones, something especially important for seniors dealing with both arthritis and osteoporosis. It's important to pair this remedy with other proven strategies for arthritis relief, including gentle daily movement, like stretching or low-impact exercises such as swimming and walking to keep joints flexible, an anti-inflammatory diet, rich in omega-3 fatty acids, fresh fruits, vegetables, and whole grains, mindful weight management to reduce unnecessary stress on joints, and, when needed, targeted supplements like vitamin D, calcium, and magnesium to support joint and bone health. While baking soda isn't a magic bullet that will eliminate arthritis pain overnight, it offers a simple, affordable, and science-backed tool to help reduce the underlying inflammation that makes arthritis so painful. When used responsibly and in combination with a comprehensive wellness plan, it may just help you regain some of the mobility and comfort you thought were lost forever. Next, we'll explore a painful and often misunderstood condition, gout, and how baking soda's alkalizing properties can help manage and reduce the frequency of these painful flare-ups. When cold and flu season rolls around, many of us brace ourselves for days, sometimes weeks of sore throats, stuffy noses, body aches, and endless coughing fits. For seniors, these common illnesses can hit especially hard, leaving you drained of energy and struggling to recover. While over-the-counter medications might provide temporary relief, they often come with unwanted side effects like drowsiness, dry mouth, or elevated blood pressure. But once again, baking soda, a simple, natural remedy, can offer safe and effective comfort without those drawbacks. So how exactly can this humble kitchen staple help you bounce back from a cold or flu faster? At its core, baking soda is a powerful, alkalizing agent. While it can't kill viruses directly, it plays an important supportive role by helping your body fight back against infection and manage uncomfortable symptoms. Let's explore the ways baking soda works its magic during times of illness. 1. Soothes sore throats and reduces inflammation. One of the first signs of a cold or flu is that scratchy, painful throat that makes swallowing difficult. Baking soda can bring immediate relief through a simple gargle solution. Because it's alkaline, it helps neutralize the acids produced by bacteria and viruses that irritate your throat lining. This reduces inflammation and can provide soothing comfort almost instantly. Baking soda gargle recipe. Mix 1-2 teaspoon of baking soda with 1-2 teaspoon of salt in a glass of warm water. Gargle for 30 seconds, then spit it out. Repeat this several times a day, especially before bed, to ease throat discomfort and keep your mouth and throat cleaner. Clinical studies have supported this practice. A study published in the Journal of the American Dental Association found that regular gargling with a baking soda solution not only reduced throat irritation, but also lowered the microbial load in the mouth and throat, helping to limit the spread of infection and support faster recovery. 2. Relieves nasal congestion and clears sinuses. A stuffy nose is one of the most frustrating cold symptoms, making it hard to breathe, sleep, and even eat comfortably. Baking soda can help thin mucus and open nasal passages when used as part of a saline rinse. Baking soda nasal rinse recipe. Mix 1/4 teaspoon of baking soda and 1/4 teaspoon of salt into 1 cup of warm, distilled water. Use a neti pot or a bulb syringe to gently flush your nasal passages. This not only clears congestion, but also helps remove viruses and allergens from your sinuses. This simple practice is recommended by the American Academy of Otolaryngology as a safe and effective method for relieving sinus congestion and supporting respiratory health. 3. Helps break down mucus and eases coughing. During a cold or flu, your body produces excess mucus to trap viruses and bacteria. But when mucus becomes thick and sticky, it can clog your airways and trigger constant coughing fits. Drinking a warm solution of baking soda and water helps break down this mucus, making it easier to expel and relieving that tight, heavy feeling in your chest. Mucus relief drink. Dissolve 1 to 2 teaspoons of baking soda in a glass of warm water and sip it slowly. This can help thin mucus secretions and provide relief from chest congestion. 4. Supports the body's natural defenses. While baking soda doesn't fight viruses directly, maintaining a healthy pH balance supports your immune system's natural defenses. Viruses tend to thrive in acidic environments, and by gently alkalizing the body, baking soda helps create a less favorable environment for them to spread. However, it's important to emphasize that baking soda should be used as a supportive remedy, not a replacement for rest, hydration, proper nutrition, and medical care when needed. Also, be cautious not to overuse it. Stick to the recommended doses and avoid prolonged internal use without consulting a healthcare provider, especially if you have high blood pressure or kidney concerns. When cold and flu season strikes, don't overlook the simple, affordable remedies hiding in your kitchen. Baking soda can provide soothing relief from sore throats, open up congested sinuses, break down stubborn mucus, and support your body's fight against illness, all without the side effects of over-the-counter medications. In our next section, we'll explore one of the most fascinating and controversial uses of baking soda, its potential role in supporting cancer treatments and improving outcomes. Few topics are as serious and emotionally charged as cancer. For those diagnosed, every treatment decision is filled with hope, concern, and an urgent desire for effective solutions. And while baking soda may seem like an unlikely ally in the fight against cancer, emerging research suggests it may have a valuable, supportive role alongside conventional therapies. But before we dive in, it's critical to clarify one thing. Baking soda is not a cure for cancer. It should never replace professional medical treatment. However, scientists are exploring how this humble compound might enhance treatment effectiveness and improve patient outcomes in specific situations. So, what's the science behind this? 1. The acidic microenvironment of tumors. One of the lesser-known characteristics of cancer cells is their tendency to thrive in an acidic environment. This happens because tumor cells often switch to a type of metabolism known as anaerobic glycolysis, even in the presence of oxygen. This process produces lactic acid as a byproduct, creating a low pH, acidic environment around the tumor. This acidity doesn't just support tumor growth, it also makes tumors more aggressive and resistant to certain therapies, including chemotherapy and radiation. In fact, studies have shown that highly acidic tumors are more likely to spread and become treatment resistant. This is where baking soda, or sodium bicarbonate, enters the picture. Its powerful alkalizing properties can help neutralize the acidic environment around tumors, potentially making cancer cells more vulnerable to conventional treatments. 2. Groundbreaking research: baking soda and tumor growth. A landmark study published in the journal Cancer Research in 2009 tested this very theory. Researchers at the University of Arizona found that administering sodium bicarbonate to mice with metastatic breast cancer significantly reduced the acidity of tumors, slowed their progression, and even improved the effectiveness of chemotherapy treatments. The study concluded that altering the tumor microenvironment through pH management could be a promising strategy for enhancing cancer therapy outcomes. While these results are from animal studies and cannot be directly applied to humans without further research, they open the door to a new area of exploration in cancer care. Another study published in Onco-Target in 2016 found similar results, suggesting that managing pH levels could make tumor cells more susceptible to drugs and reduce their ability to metastasize. 3. How might this work in practical terms? The idea isn't to flood the body with baking soda, which could be dangerous. Instead, researchers are exploring carefully controlled protocols where small doses of baking soda help buffer the pH in specific areas of the body, particularly around tumors. This may help improve the effectiveness of chemotherapy drugs, reduce the spread of cancer cells to other parts of the body, alleviate some side effects related to the buildup of acids in cancer patients, such as muscle wasting and fatigue. However, it's important to stress that this approach remains experimental. Large-scale human clinical trials are still needed to confirm safety and effectiveness. 4. The dangers of self-medicating. While the science is fascinating, there's also a real risk when people try to self-administer baking soda in large amounts. High doses can lead to serious health complications, including metabolic alkalosis, where the body becomes dangerously alkaline, electrolyte imbalances, leading to muscle weakness, irregular heart rhythms, and confusion, increased blood pressure and fluid retention, especially in seniors with heart or kidney issues. If you or a loved one is undergoing cancer treatment and are curious about this approach, it's absolutely essential to consult with your oncology team before considering baking soda as a supportive therapy. Baking soda may one day play a role as a complementary therapy to help improve treatment outcomes for certain cancers, particularly by targeting the acidic environments that tumors thrive in. While the research is still in its early stages, it offers a hopeful reminder that even the simplest substances can have untapped potential in the ongoing fight against disease. In the final section of this series, we'll discuss a more everyday use: how baking soda makes an effective, safe, and natural alternative to commercial deodorants, keeping you fresh without exposing your body to harsh chemicals. In today's world, we're more aware than ever of the chemicals hidden in our everyday personal care products. One area of growing concern is commercial deodorants and antiperspirants, which often contain ingredients like aluminum compounds, parabens, artificial fragrances, and other synthetic chemicals. While these products promise long-lasting protection against odor and sweat, many people, especially seniors, are starting to wonder at what cost. That's why more and more people are turning to safe, natural alternatives like baking soda to stay fresh and odor-free, without worrying about harmful ingredients. And the best part, it's simple, affordable, and backed by science. 1. How does baking soda work as a deodorant? Baking soda is a natural odor neutralizer. Unlike commercial deodorants that simply mask body odor with strong fragrances, baking soda tackles the root cause. Here's how. Your body produces sweat as a way to regulate temperature, but sweat itself is actually odorless. The unpleasant smell occurs when sweat comes into contact with the bacteria that naturally live on your skin. These bacteria break down the proteins and fats in sweat, producing waste byproducts that cause that recognizable body odor. Baking soda works by creating an alkaline environment where odor-causing bacteria struggle to thrive. It also helps absorb excess moisture, keeping you dry and comfortable throughout the day. A study published in the Journal of Cosmetic Dermatology confirmed that sodium bicarbonate significantly reduces underarm odor when used as a topical application. Researchers noted that baking soda's alkalizing effects help counteract the acidic waste products produced by bacteria, effectively neutralizing unpleasant smells. 2. How to use baking soda as a deodorant. You can apply baking soda in several simple, safe ways. Dry powder application. After showering and drying your underarms, simply dust a small amount of baking soda onto your skin using your fingers or a soft makeup brush. This keeps you fresh and dry throughout the day. Soothing baking soda and coconut oil paste. If you have sensitive skin or want to add moisturizing benefits, mix 1 tablespoon of baking soda with 2 tablespoons of coconut oil and a few drops of your favorite essential oil like lavender or tea tree for their antibacterial properties. Apply a small amount to your underarms. DIY natural deodorant bar. Combine baking soda with coconut oil, shea butter, and cornstarch to form a solid deodorant bar. Store it in the fridge to keep it firm during warmer months. 3. Is it safe for sensitive skin? While baking soda is generally safe and gentle, some people with very sensitive skin may experience mild irritation if they use too much or apply it directly after shaving. Here are some ways to avoid irritation. Always test a small area before applying regularly. Avoid using baking soda immediately after shaving when skin is most sensitive. Dilute with moisturizing oils like coconut oil or shea butter if you notice dryness or redness. Try using baking soda only every other day and see how your skin responds. If irritation does occur, simply stop using it for a few days and allow your skin to recover. Remember, when it comes to natural solutions, a little goes a long way. 4. Why choose baking soda over commercial deodorants? No harmful chemicals. Avoid exposure to aluminum, parabens, and synthetic fragrances that are often linked to hormone disruption and skin irritation. Budget-friendly. Baking soda costs just pennies per use and is available at any grocery store. Environmentally friendly. Using baking soda means fewer plastic deodorant containers in landfills and no harsh manufacturing chemicals polluting the environment. Multi-purpose. Beyond deodorant, you can use the same box of baking soda for dozens of other health, cleaning, and personal care solutions. Sometimes the simplest solutions really are the best. Baking soda offers a safe, natural, and cost-effective way to stay fresh and confident all day long without exposing your body to unnecessary chemicals. Whether you're attending a social event, going for a walk, or simply enjoying a quiet afternoon at home, you'll know you're protected by a remedy that stood the test of time and science. And that brings us to the end of this incredible journey exploring the 13 powerful health benefits of baking soda. From supporting kidney health and easing arthritis pain, to relieving heartburn, and even offering potential support for cancer treatments. This everyday kitchen ingredient has proven itself to be a truly versatile ally for better health and well-being. Thank you for joining us. If you found this information helpful, don't forget to like, subscribe, and share it with friends and family. And tell us in the comments, have you tried any of these baking soda remedies? We'd love to hear about your experiences. Until next time, stay healthy, stay curious, and remember the simplest solutions are often the most powerful.